Hello, I'm Heather Knox, Chief Executive here in NHS Lanarkshire. I want to talk to you today about three things. First of all, I want to talk a bit about the numbers that we have of patients across Lanarkshire suffering from COVID in our hospitals. Secondly, I'm going to talk a bit about the vaccine. That's quite exciting because that's now just beginning to start, which is great news for everybody. And thirdly, I'm just going to talk a wee bit about visiting in our care homes. So first of all, if I can talk about the numbers across Lanarkshire. So over the last week, we've had inpatients occupied by COVID patients of around 160. That number has remained stubbornly about that level, but we have seen it on a trend coming down over time, so we're hoping it will come down further soon. The good news this week, and I haven't had much good news about ITU for several weeks, but we now are beginning to see a reduction in our ITU cases with, I think it was 7 patients in ITU across our 3 acute sites yesterday. So that's hugely positive, and it's been a long haul for these staff working at the front line in ITU, so I want to take this opportunity to thank them especially for their efforts. Secondly, I want to talk a wee bit about vaccine delivery. We started vaccine delivery fairly slowly, but by yesterday we had delivered 175 vaccines. The vaccines are being targeted in the first instance to our frontline staff working within red pathways, so that's both within the hospital setting and in the community, and we will do those staff first and foremost. The first wave of the vaccine delivery has been divided into 2 phases. So that first phase is the group of staff I've already talked about, and then the rest of the NHS staff and the over 80s will probably come into that second part of the first wave, so that'd be phase 2. The vaccine we're delivering at the moment is the Pfizer vaccine, but it looks likely that we would have access to the AstraZeneca vaccine, hopefully sometime over the next few weeks. That's just going through its final stages of approval, so we would hope to have some news about that one as well around about Christmas time or the early new year. And obviously that would give us 2 vaccines then to use for staff. So although we've started off slowly, this is a marathon, not a sprint. As I keep saying to people, it's going to take a long time. It's a whole population programme, so we've got a lot of people to vaccinate in Lanarkshire, over 600,000 people. I envisage it taking right the way through to the spring, early summer, so it's a long time that we're going to be doing the vaccinations. We started off with low numbers, as I say, but 650 planned for tomorrow, so we will soon get our numbers up and running, aiming to do about 20,000 in that first wave. So that's the bit about the vaccine. The third thing, just briefly to say, hopefully you'll have seen on the news that there's been new advice and guidance issued around care home visiting. So with protective PPE for half an hour a day, a nominated visitor can now visit their loved one within a care home, and that's been a lot of work to get to that place, and I'm sure you'll appreciate that's great news for a number of people living locally, that they can actually go in and see their loved ones at this special time of year. Finally, I just want to say, if possible, please do try to get some downtime over the Christmas period, and relax with your families, and obviously we hope that the next few months will get most people vaccinated, and we will be moving forward more positively in the new year. Thank you for listening.